Hey y'all, it's Rochelle, Hot Doc Shelley Smith. I am a doctor of nursing practice, specialized in women's health, and today we're going to review the female reproductive system. The female reproductive system has two parts. We have the internal and the external parts of it. The internal part is also called the female reproductive tract. And starting at the bottom where you see the word vagina, we have the vaginal canal, which separates the internal from the external. And it's very important to maintain the pH of the vagina because it helps to keep the vagina clean. As we move upwards, you have the cervix, which is also the neck of the uterus. It looks like a little donut when viewing from a speculum. And it goes up into the uterus, which is the muscular body that comprises of two layers. We have the internal layer, which is called the endometrium. The endometrium is where blood builds up and is shed during the menstrual period if an egg is not fertilized. Otherwise, it is used to implant the fertilized egg for a pregnancy. The outer layer is called the myometrium. It's also a thick muscle used to contract to assist in labor to push the baby out through the cervix and the vagina. The top of the uterus is called the fundus, and extending out from the fundus, we have the fallopian tubes, which are responsible for carrying the egg and the sperm for fertilization. And then after the egg is pushed out of the ovary during ovulation, the ovaries also produce estrogen and progesterone, which helps to maintain the endometrium during the pregnancy. Now we're going to go ahead and review the external genitalia, which is also known as the vulva. We have the mons pubis, which is like the fatty pad that overlies the pelvic bones. And then we have the two skin folds called the labia. The external labia is called the labia majora, and it extends from the mons pubis down to the perineum. And then the inner fold is called the labia minora, and that one extends from the clitoris down to the vaginal orifice. As we move in from the labia, this area is called the vestibule, and at the superior top of it is the clitoris, and it has a lot of sensory nerves, so it plays a major role in sexual arousal. And down from that, we have the external urethral opening, which is important to expel the urine from the body. And then we have the vaginal orifice, which is also known as the vaginal opening. So there you have it, the internal reproductive tract and the external genitalia, which makes up the female reproductive system. Watch this video and become familiar with the terminology because it's going to be very important going forward as we continue our journey to improving female sexual health, one woman at a time. Like, share, and save this video. Y'all take care and be blessed. Peace.